Breast cancer refers to a malignant tumor that has developed from cells in the breast. Usually breast cancer either begins in the cells of the lobules, which are the milk-producing glands, or the ducts, the passages that drain milk from the lobules to the nipple. Less commonly, breast cancer can begin in the stromal tissues, which include the fatty and fibrous connective tissues of the breast. The breast is made up of different tissue, ranging from very fatty tissue to very dense tissue. Within this tissue is a network of lobes, and each lobe is made up of tiny, tube-like structures called lobules that contain milk glands. Tiny ducts connect the glands, lobules, and lobes, carrying milk from the lobes to the nipple. The nipple is located in the middle of the areola, which is the darker area that surrounds the nipple. Blood and lymph vessels also run throughout the breast. Blood nourishes the cells, and the lymph system drains bodily waste products. The lymph vessels connect to lymph nodes, the tiny, bean-shaped organs that help fight infection. Cancer begins when healthy cells in the breast change and grow out of control, forming a mass or sheet of cells called a tumor. A tumor can be cancerous or benign, and a cancerous tumor is malignant, meaning it can grow and spread to other parts of the body. A benign tumor means the tumor can grow but will not spread. Breast cancer spreads when the cancer grows into other parts of the body or when breast cancer cells move to other parts of the body through the blood vessels and/or lymph vessels. This is called metastasis. Although breast cancer most commonly spreads to nearby lymph nodes, it can also spread further through the body to areas such as the bones, lungs, liver, and brain. This is called metastatic or stage 4 breast cancer. If breast cancer comes back after initial treatment, it can recur locally, meaning in the breast and/or regional lymph nodes. It can also recur elsewhere in the body, called a distant recurrence or metastatic recurrence. More women are diagnosed with breast cancer than any other cancer. Every year in the United States, an estimated 250,000 women are diagnosed with invasive breast cancer, and 63,410 women will be diagnosed with in situ breast cancer. An estimated 2,600 men in the United States will be diagnosed with breast cancer. Risk factors for developing breast cancer include being female, obesity, lack of physical exercise, drinking alcohol, hormone replacement therapy during menopause, ionizing radiation, early age at first menstruation, having children late or not at all, older age, and family history. About 5 to 10% of cases are due to genes inherited from a person's parents, including BRCA1 and BRCA2 among others. Breast cancer most commonly develops in cells from the lining of milk ducts, and the lobules that supply the ducts with milk. Cancers developing from the ducts are known as ductal carcinomas, while those developing from lobules are known as lobular carcinomas. In addition, there are more than 18 other subtypes of breast cancer. Some cancers, such as ductal carcinoma in situ, develop from pre-invasive lesions. The diagnosis of breast cancer is confirmed by taking a biopsy of the concerning lump, and once the diagnosis is made, further tests are done to determine if the cancer has spread beyond the breast, and which treatments it may respond to. More than 40,000 people die from breast cancer each year. About 5% of women have metastatic cancer when they are first diagnosed with breast cancer. Even if the cancer is found at a more advanced stage, new treatments help many people with breast cancer maintain a good quality of life, at least for time. It is important to note that these statistics are averages, and each person's risk depends on many factors, including the size of the tumor, the number of lymph nodes that contain cancer, and other features of the tumor that affect how quickly a tumor will grow, and how well treatment works. Breast cancer is the second most common cause of death from cancer in women in the United States, after lung cancer. However, since 1989, the number of women who have died of breast cancer has steadily decreased thanks to early detection and treatment improvements. Currently, there are about 3 million women living with breast cancer in the United States with breast cancer. The first noticeable symptom of breast cancer is typically a lump that feels different from the rest of the breast tissue. More than 80% of breast cancer cases are discovered when the woman feels a lump. The earliest breast cancers are detected by a mammogram, and lumps found in lymph nodes located in the armpits can also indicate breast cancer. Indications of breast cancer other than a lump may include thickening different from the other breast tissue, one breast becoming larger or lower, a nipple changing position or shape or becoming inverted, skin puckering or dimpling, a rash on or around a nipple, discharge from nipples, constant pain in part of the breast or armpit, and swelling beneath the armpit or around the collarbone. Pain is an unreliable tool in determining the presence or absence of breast cancer, but may be indicative of other breast health issues. Inflammatory breast cancer is a particular type of breast cancer which can pose a substantial diagnostic challenge. Symptoms may resemble a breast inflammation, and may include itching, pain, swelling, nipple inversion, warmth and redness throughout the breast, as well as an orange peel texture to the skin. As inflammatory breast cancer does not present as a lump, there can sometimes be a delay in diagnosis. Another symptom of breast cancer is Paget's disease of the breast. This syndrome presents as skin changes resembling eczema, such as redness, discoloration, or mild flaking of the nipple skin. As Paget's disease of the breast advances, symptoms may include tingling, itching, increased sensitivity, burning, and pain. There may also be discharge from the nipple. Approximately half of women diagnosed with Paget's disease of the breast also have a lump in the breast. In rare cases, what initially appears as a fibroadenoma, which is a hard, movable non-cancerous lump, could in fact be a phyllodes tumor. Phyllodes tumors are formed within the connective tissue of the breast, and contain glandular as well as stromal tissue. Phyllodes tumors are not staged in the usual sense, they are classified on the basis of their appearance under the microscope as benign, borderline, or malignant. Occasionally, breast cancer presents as metastatic disease, that is, cancer that has spread beyond the original organ. The symptoms caused by metastatic breast cancer will depend on the location of metastasis. Common sites of metastasis include bone, liver, lung, and brain. Unexplained weight loss can occasionally signal breast cancer, as can symptoms of fevers or chills. Bone or joint pains can sometimes be manifestations of metastatic breast cancer, as can jaundice or neurological symptoms. These symptoms are called nonspecific, meaning they could be manifestations of many other illnesses. Most symptoms of breast disorders, including most lumps, do not turn out to represent underlying breast cancer. Fewer than 20% of lumps, for example, are cancerous, and benign breast diseases such as mastitis and fibroadenoma of the breast are more common causes of breast disorder symptoms. Nevertheless, the appearance of a new symptom should be taken seriously by both patients and their doctors, because of the possibility of an underlying breast cancer at almost any age. It is important to remember that statistics on the survival rates for people with breast cancer are an estimate. The estimate comes from annual data based on the number of people with this cancer in the United States. Also, experts measure the survival statistics every 5 years. So, the estimate may not show the results of better diagnosis or treatment available for less than 5 years. You should talk with your doctor if you have questions.